Cameron, what is sedation dentistry? Because I know you offer it here at Aspen Dental.
So sedation is just altered consciousness. Okay, it's how aware you are, and it also can affect how much you remember. But sedation is, in general, is just an altered state of consciousness. Anything from lightly altered to fully asleep, and there's a whole range that goes through that.
I guess it's a medical procedure, right? Especially if you're going to be fully unconscious.
Yeah, absolutely, and it requires special care. Okay, I mean, if I've got someone coming in for a sedation, that's not just another filling for me. There's a lot of preparation that goes into that. I need to know their medical history to make sure I'm doing what's safe for them, because if we're not planning and preparing, it could potentially be unsafe.
Okay. So, yeah, that was my question. It can be unsafe sometimes, especially if you've got somebody who doesn't necessarily know what they're doing.
Yeah, absolutely. I mean, no dentist is going to offer any sedation they're not trained to handle, and they're going to be aware of the signs and symptoms to know how sedated someone is, so they can properly take care of them, especially when it's the dentist providing the sedation and the treatment at the same time. You know, we have to be prepared for that, and we have to have all the setup to monitor even your vital signs. I mean, some people ask, sometimes we hook them up to the monitor when they've just taken a pill.
Right.
Well, those pills can alter your consciousness enough that it could become unsafe if we're not watching and aware.
Okay.
So you've got monitors on, just like when you're in a hospital setting, they're the same style of monitor. We're watching your blood pressure, watching your heart rate, even how you're breathing.
Okay.
Because if something goes deeper than we intended, we need to know so we can act.
Right. So it is safe, providing you know what you're doing. Here at Aspen Dental, you have all these facilities, and you were saying that you might get somebody else in to do a full rendering of unconsciousness.
Yeah, if someone wants to be fully asleep, like general anesthesia, that's a dentist anesthesiologist that comes in, and we have a Dr. Croft that comes in, and he'll do that for our patients when that's requested, and we plan for it, where they are fully asleep. He's maintaining their life, just like an anesthesiologist would in the OR. So he can do that, and he has all the gear to do it if we need to go that deep.
Okay.
If we don't need to go that deep, we can do that here, whether it's the laughing gas, the pill, the IV. We're set up and we do that on a regular basis here for our patients that they're nervous, they're scared, they don't want to remember much, but they don't really feel like they need to be fully asleep.
Okay. Sounds like he's talking about me, actually. So, a really great thing to know, actually, if you are afraid and you do need a little sedation, come on down to Aspen Dental and talk to Dr. Cameron or one of the dentists here, and they will take care of you.
Absolutely.
Yeah. Thanks, Dr. Cameron.